Short-term impact of stroke tends to become a long-term problem. In a research done on caregivers of stroke patients, it was discovered that they have significantly higher levels of strain and psychological morbidity than the general population. They have also found cases of anxiety and depression. Research also shows that caregivers have a lack of social interaction in domains such as work, leisure, and friendship. Strokes also have a significant impact on the financial system of the patient and their family, as well as the healthcare system.
Physical impact and effects vary from patient to patient. However, generally, patients experience muscle weakness, paralysis, foot drop, fatigue, pain, spasticity, and contractures. Some of these impacts were displayed in Anna's situation, in which she had the inability to move the left side of her body, her mouth was drooping, and she couldn't speak. Social impact problems include social isolation, decreased community involvement, economic strain, disruption in family life, poor motivation, dependency, and a loss of control. Additionally, from a financial standpoint, families may struggle to make ends meet with the loss of income that comes from stroke survivors being unable to work. It's also important to consider the psychological effects of a stroke. There's 3 major emotional and behavioral changes that can occur. Firstly, anxiety and depression that can be brought on both as a biochemical response or as a normal mental response to the losses from a stroke. Second is a pseudobubbler effect, which is a neurological condition caused by a disconnect between the frontal lobe and the cerebellum. It's categorized by uncontrollable fits of laughing, crying, or even bouts of anger that can last anywhere from a few seconds to minutes. And lastly, there's lowered self-esteem. This is quite self-explanatory, however it's still vital to mention as one's self-esteem is a powerful mental tool.
As the number of patients with long-term disabilities from stroke who require rehab increase, there's an added stress for the NHS. Currently, patients who require any form of rehab from stroke or any long-term illness must enter a postcode lottery system in place by the NHS, but many people have waited several weeks for treatment. Many patients feel that the NHS had abandoned them and only helped them in need of urgent care, but not in the time that they needed long-term care. Of the patients who required long-term rehab, only 50% of these patients that have suffered from cardiac arrest or stroke received the proper cardiac rehab that they required. That cannot receive the rehab they require continue to have long-term disabilities post their stroke that can even get worse without adequate care. As a result of a lack of patient care, patients were unable to work or even resume their normal activities. This caused patients to continue to suffer social and psychological issues that reduce their quality of life.